Assalamualaikum warahmatullahi wabarakatuh. My name is Abraham Maisa, and today I will present to you an infographic titled Clinical Waste Handling and Obstacle in Malaysia. This infographic is based on a study carried out at Government Hospital in Selangor, and the study used the data from year 2009 and was published in year 2010. In this presentation, I will explain what clinical waste is, how hospital manage it, and the problem they face, and the way to improve the system. For introduction, firstly, what is a clinical waste? Clinical waste is a waste produced during the medical and healthcare activities. It include blood, body fluid, human tissues, used dressings, medicines, needles, and other sharp object. Clinical waste can be dangerous if it's not handled properly. It may spread infections and cause injury. It can also harm the hospital workers, patients, publics, and the environment. Around 15 to 25% of the clinical waste is infectious by weight. This study also states that Malaysia produces about 8,000 tons of clinical waste per year. Therefore, clinical waste must handled carefully and safely. For the objective, this study had four main objectives. The first one is to examine how the government hospital in Selangor managed clinical waste. The second one is to study the full waste handling process, including the collections, storage, transportation, treatment, and disposal. The third objective was to identify the main problem and the safety weakness. And lastly, final objective was to suggest the way to improve the system. In these studies, it involved 9 out of the 10 government hospitals in Selangor. The hospital had between 93 to 864 beds. On average, they produce about 1.355 kilogram of clinical waste per bed per day. Okay, next is the methodology for these studies. The researcher interviewed the supervisor who were responsible for the clinical waste. They also used forms to collect information about the amount of waste, staff trainings, and waste handling practices. The researcher asked about the problem faced by the hospitals. They also asked about the waste handling during the H1N1 periods. After the interview, the written information was returned to the participants. The participant checked it to make sure the information was correct. For the clinical waste pathway, now let us look at the center of the infographics. The first step is the segregations, which means the separating the waste. Clinical waste is placed inside the yellow bags. Needles and other sharp objects were placed inside the special sharp container. This should be done immediately after the waste is produced. The correct separation is important because one sharp object placed in a wrong bag can injure a worker. The second step is collection. In the hospital studies, waste was normally collected at 8:30 in the morning and until 11:30 in the morning. So the second step is storage and weighing. The waste was weighed before being moved into the cold storage. This normally happen between 11:30 in the morning and 12:30 in the afternoon. The cold storage help control bad smells and slow down the growth of the harmful microorganism. The fourth step is transportation. The waste was transported for the treatment either every day or 3 times per week. So the final step is incineration. This means burning the waste at a very high temperature. Incinerator could treat around 500 kilogram waste per hour. The first chamber operated at 950 degrees Celsius, while the second chamber reached to 1200 degrees Celsius. This high temperature helps destroy infectious materials and kill the microorganism. For the current practices and training, the hospital already follow several safety practices. Yellow bag were used for clinical waste. Sharp box were closed when they were about 3/4 full. Worker also wore personal protective equipment, including gloves, aprons, and boots. Waste bin were washed every day. The collected waste was moved into the cold storage. Training also were provided, and porter received training at least 3 times per year. Hospital staff also receive a regular training. The new staff were taught how to separate and handle waste safely. So this is show that some of the safety measures were implemented in the hospital, but however, public education mostly limited, usually by using a poster that near to the waste bin. So the main obstacle and finding for the study, even though the hospital had a waste management system, they still face several problem. One major problem was the incorrect waste separation. Some needles were disposed incorrectly, so it's exposed to the staff and patient. Because some of the staff and patient did not have enough awareness to proper clinical waste handling. Hospital also had a limited space for storing, washing, and drying waste bin. Waste could spill during the handling and transportation. This increased the risk of the infectious and cross-contamination. The amount of waste was different in each hospital. Larger hospital and hospital in urban area normally produce more waste. The department that produce high amount of the waste, including operation theatre, mandatory wards, intensive care units, emergency department, and dengue ward. Another problem happened when the normal waste was mixed with a clinical waste. This increased the amount of requiring special treatment and made disposal more expensive. For the recommendation for the study, it's actually the study suggested several ways to improve the system. The first one is the hospital should check the waste separation more often. The staff should also receive a better supervision to improve the system. Hospital should provide special storage room, safer transportation route, and suitable equipment for washing and drying the bin. The third suggestion was training should provided to the hospital workers, patient, and member of the public, all of them. And the fourth is hospitals should also review their service charges, policies, and working procedure. Next, the last one is more research should be carried out on a waste reduction and safe recycling and other treatment methods. Hospitals should try to reduce the waste from the beginning instead of depending only on incineration. So next is SWOT analysis. The first part is strength. The hospital already had a clear waste handling process. The worker receives a hefty training and use a personal protective equipment. Hospital also had a waste collection services and access to the incineration. That's the strength part. And the second part was a weakness. Some waste was not separated correctly, and also awareness among the staff and patient was still limited. Some hospital also lack space and suitable equipment. And the other one is the unsafe waste transfer could cause injury or infection from the waste. So the next part is opportunities. Hospital can improve their design of the storage and washing area. They can provide more training and better supervision, and also new research and treatment technology can improve the system if there are more researchers want to contribute in the clinical waste system. The final part is threat. The main threat including infection, injuries from the needles, exposure to the spillways, higher operating costs, and the environmental pollution. Overall, the hospital already had a basic system. However, the system still require better facilities and a stronger awareness, and also regular monitoring. For the sustainability link, clinical waste management is connected to the 3 sustainable development goals. The first one is SDG 3, which means good health and well-being. Safe waste handling protect the workers, patient, and public from the infectious. The second one is SDG 6, clean water and sanitation. The correct waste handling helps prevent harmful materials from entering the water system. And the third SDG is SDG 12, responsible consumption and production. It encourage the correct waste separation, waste reduction, and safer treatment methods. Therefore, the good clinical waste management protect both people and environment. So this study, this infographic is based on a study by Razali and Ishaq, Shaidatu Shida Razali and Bakri Ishaq. This study was published in 2010, but it used the information collected in 2009 from the government hospital in Selangor. Therefore, the finding explain the situation at that time. They should not use to describe the current performance of the hospital in Malaysia. In conclusion, study waste must be managed carefully at every stage. Hospital need to correct waste separation, train the workers, save the storage, proper transportation, and effective treatment. When clinical waste is handled correctly from the beginning, hospital can reduce the infections, injuries, environmental pollution, and unnecessary costs. Thank you for watching. That's all from me. Assalamualaikum.